Hi everybody, so I wanted to make a more light-hearted video for this one. This channel is going to have plenty of serious videos, plenty of emotional videos on it, and that's absolutely fine. But I wanted to do something a little more light-hearted. I apologise for the lighting in here. It is horrible, dark and wet and rainy outside, so I've had to put this main light on. I wanted to take you through what I will be packing for my stay at the hospital. You know, like they do those videos on YouTube where it's like, come pack with me for my holiday to the Caribbean island of whatever. Well, come with me as I pack for my stay at Hotel La Moorfields, where I will be having my brachytherapy on my eye. So first of all, I should say that I have never had to stay in hospital before. So when I learned that I would have to be in hospital for a few days, I was really quite anxious because I was like, what do I wear? What other things am I meant to be bringing with me? And I put a post on the ocular melanoma patient Facebook group and loads of people replied to me with some really great suggestions. And might I say, a lot of those were for snacks, and we'll get into that. Obviously clothes and some toiletries that are probably going to be helpful because it might be a bit difficult to wash and shower because of the eye. So first of all, let's do clothes. I needed to get myself some more pyjamas because the ones I have at home have probably seen better days, and I wanted to have something decent for going into hospital. I'll put some footage of me trying these pyjamas on over my clothes, but there's a retailer here in the UK called Next, and they do 2 pyjama sets for £32, which I thought was pretty good. So you get the top and the bottom. As you can see from the footage, it's like a button-up top. The material is really soft, it's stretchy, it's an elasticated waistband. The other one I got in this set was grey. Grey is one of my favourite colours. Don't know what that says about me. I also got some fluffy socks because my feet tend to get really cold and I just wanted something comfortable to wear either in bed or if I'm just sitting around in my room. In terms of slippers, I do like the boot slippers, and I did have a pair of boot slippers, but they were for the bin. So I got these new ones and they've got hard soles. And last but not least, the thing which really will set my hospital chic off. Not that anyone is going to see this because I'm going to be in my room all the time. I didn't really think about that. But you know, I didn't have a dressing gown, and I thought I want something that's really cozy and makes me smile. And as I've said before, I tend to worry far too much about what people think, and that is going to change now. So I was looking at all these different dressing gowns and I found this one with a Highland cow pattern, and I love it. And I ummed and ahed over getting it, thinking, what are people going to think if you're wearing a Highland cow dressing gown? Who cares? So I got it, and it is so soft. It's got a hood. It's really cozy. That is pretty much all my clothing. Let's talk toiletries. I won't go through all of it, but someone in the group came up with a really helpful suggestion of body wipes. Wet wipes, because they said you might not feel like a shower straight away, a day or two afterwards, so having some wet wipes will just sort of help you feel a bit fresh, because you don't tend to feel good if you feel a bit icky anyway. And they also said face wipes, because again, I'm probably not going to be able to wash my face, so having some face wipes will be good for that. I have got a bottle of shower gel and a shower puff in case I can have a shower at some point. I use an electric toothbrush at home, but I thought I'm not going to bring that. What if the battery dies? I've just bought myself a cheap ordinary one. Nothing wrong with that. That's about it for toiletries. Probably the most important aspect of this hospital visit, I feel, is snacks. So I have been told that generally hospital food is not great. I work in a hospital myself, and yeah, it's not always good, but I do appreciate that the kitchen of a hospital is catering for hundreds of people every day. So I don't know where the balance is. I'll just show you some of the snack items I'm going to take. My snack bag is big. I think I'm going to have another bag. This is my snack bag. I think I might have too much. So I'm going to be in hospital for 5 days. So I've bought, each thing I've got 5 of pretty much. So I've got a few of these. I think I've got 4 actually of those. I bought some protein bars. I'm under no illusion that these are any much healthier than a chocolate bar. However, I do like to keep my protein up. I do weightlifting as my exercise, so I do try and keep the protein up. I'll try and have about 80 to 100 grams of protein a day. And I know 5 days in hospital, it's not going to affect me too much, but I want to try and keep that up as much as possible to maintain some muscle mass. I'm really going to miss not being able to weight train, but I've got to leave it off for as long as needs be to help the eye. I bought these salt and vinegar crunch. They have a bit more protein in them than crisps. I'm going to take crisps as well. I mean, I feel like I'm over prepared, but other people have said they had a whole bag for their snacks. So I think I'm going to be okay. So these are Outpro Protein, kind of like a yogurt, but they've got more protein in them. I've already tried one. They're meant to be banana flavoured. They're not very banana-y, but they'll do. And I've also got some of those, the Alpro soya yogurts, basically. One is dark chocolate flavour and the other one's caramel. I think I'm going to need either a bigger suitcase or a suitcase just for my snacks, judging on how things have turned out. I'm trying to remember, I'm going to be in this room for 5 days. No one is going to be coming in the room apart from the nurses to check on my eye to make sure it's not kind of rolled off anywhere, I guess. I think they can give me painkillers and make sure it's not getting infected. My husband can come and see me up to 2 hours a day, but not any longer because of the small radiation. So I'm pretty much going to be on my own. The next most important thing I think is Boredom alleviating materials. I didn't really think this first purchase through. These were £5 for 4 books. They are large print word searches. Now, I don't know if I'm actually going to be able to read much because this eye will be covered. This eye, my distance vision is better, so my close-up isn't, so I need glasses, but I'm not going to be able to wear my glasses if this thing has got a great big thing over it. It might be all right if these are large print. It might be okay. I'm going to take them. I'm probably just going to take 2. I don't think I'll need 4. Other things I've downloaded some audiobooks onto my phone through Audible. So one of them is a book that I was already reading, so I thought I'll carry on with that. And then there are a few other books that I wanted to purchase hard copies of that I've now purchased them as audiobooks. My husband also bought me a tablet, bless him. The phone might be a bit tricky because it's so small, so the tablet will be easier to use, I think. So audiobooks, also some podcasts I've downloaded. I think I'll be okay. I'm someone who enjoys my own company. I'm quite happy to be on my own, but I think it's a bit different when it's enforced and it's for 5 days. I also might take my journal. I journal every day. Again, I'm not sure if I'm going to be able to do writing if I can't see that grey out of this eye, but I will try. People have said though that the radiotherapy can make you feel quite fatigued. So it may be possible that I do sleep a lot and I don't get to listen to as many audiobooks as I want to, or I don't need to rely on as many snacks as I think I will because I'll be sleeping. And that's fine as well, because if that helps pass the time, that's great. I think I'm all set. I am feeling nervous, but I am eager to get it done and get home and have some time off to recover. So by the time this video goes out, by the time I schedule it, I will have had my procedure done, and hopefully I'll either be on my way home or I'll be coming home the day after this goes out. And then I'll see how I feel when I get home. I'd like to do a video about how I'm getting on, but equally, if this eye is feeling a bit sensitive and I'm feeling fatigued, I'm just going to do what I need to do. But rest assured, I do want to talk about how it's feeling when I get home. I was going to say, if you've got any suggestions for what to take, let me know in the comments, but it'll be too late by that point, so don't worry about it. If I forget anything, I forget anything. It's fine. It'll be what it is. Go well, everybody, and I will see you very soon.